Hi, I'm Dr. Dellaria. We're using the brimhall adjuster today. This is the instrument. It creates a force which lightly adjusts the bone back into place. Through a series of impulses, it brings the bone back into proper alignment. With a manual adjustment, it would be bringing the bone back in one impulse. So we find the bones that are misaligned and adjust them back. Areas can still be tender, but for the most part it's fairly pain-free. Good. And then we have motion where we didn't have motion before. And how did that feel?
Feels great.
Okay, great. That's the brimhall adjuster.